Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Ankle injuries and disorders. Introduction. Your ankle bone and the ends of your two lower leg bones make up the ankle joint. Your ligaments help steady and support it. Your muscles and tendons move it. Ankle injuries and disorders are common problems. Some ankle injuries and disorders may be treated at home. Others require medical treatment. Treatment depends on the problem. It may include medicines, surgery, or other treatments. This program explains ankle injuries and disorders. It covers common injuries and disorders that affect the ankle as well as their treatment options. The ankle. The ankle is a large joint. It lets the foot move up and down. Three main bones come together to form the ankle joint. These include the tibia, fibula, talus. The tibia is also called the shin bone. It is the large bone in the lower leg. It also forms the inside part of the ankle. The fibula is the smaller bone in the lower leg that runs along the tibia. It forms the outside part of the ankle. The talus is the bone above the heel. It sits below the tibia and fibula. The subtalar joint sits below the ankle joint. It allows the foot to move side to side. Many ligaments surround the ankle and subtalar joints. Ligaments are tough tissues that connect bones. Ligaments steady and support the joint. Muscles and tendons help the ankle move. Muscles are made of a stretchy, elastic tissue. Small fibers make up each muscle. Tendons are the tough cords of tissue. They attach muscles to bones. They help your muscles move your bones by pushing or pulling the bones in different ways. Cartilage is a material that keeps the bones from rubbing against each other during motion. It covers the ends of the bones in the ankle joint. Synovium is a little bag containing a small amount of fluid. It is located between the two pieces of cartilage in a joint. Cartilage and synovium work together for smooth, painless motion in any given joint. General symptoms. Symptoms of ankle injuries and disorders can vary widely and depend on the problem. The most common symptom is pain in the ankle or foot. Other common symptoms of ankle injuries and disorders are being unable to move your foot or toes, bruising, difficulty walking, swelling or weakness in the joint. Some ankle injuries and disorders may also cause a deformed ankle, feeling of a pop or tear, knee pain, numbness in the ankle, foot, or toes, redness or tenderness at the joint. Ankle injuries and disorders can cause other symptoms as well. If you notice any of these symptoms or other changes, talk to your healthcare provider.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Sprains. A sprain is a stretched or torn ligament. Ligaments are tissues that connect bones at a joint. There are many ligaments in the ankle that may be sprained. Many things can cause a sprain. Falling, twisting, or getting hit can force a joint out of its normal position. This can cause ligaments around the joint to stretch or tear. Sprains can happen if people experience a sudden blow to a joint, fall on the side of their foot, twist the ankle, walk or exercise on an uneven surface. Some people are at greater risk of getting a sprain. Risk factors include a history of sprains, being overweight, being in poor physical condition, not properly warming up before being physically active. Treatment of sprains depends on the severity of the injury. It usually involves resting the injured area, icing the injured area, wearing a bandage or device to compress the area, using medicines. To reduce swelling and pain in the first day or two, healthcare providers usually recommend resting the injured area. You may need to use crutches or a cane to get around. Put the injured ankle up on a pillow when sitting. Ice should be placed on the injured area for 20 minutes at a time. You may be told to do this 4 to 8 times each day. Wearing a bandage or a device that binds the injured ankle can also help reduce swelling and pain. Medicines such as aspirin and ibuprofen can also help. Treatment for sprains may later include exercise and physical therapy. Exercise helps to prevent stiffness and to increase strength. Physical therapy helps make the injured area stronger and more stable. Surgery may be needed if you have a torn ligament or ruptured muscle. Your healthcare provider will tell you when you can start to do normal activities, including sports. If you start too soon, you can injure the area again. Fractures. A fracture happens when a bone in the body breaks. Fractures may affect the ankle joint. Most often, the tibia or fibia is broken in or near the ankle joint, but sometimes a fracture can affect the talus. Fractures can happen at the same time as sprains in the ankle. You can fracture the ankle by flexing or extending the joint too far, jumping from a high place and landing straight down on the joint, rolling or twisting the ankle. Some fractures are severe and need surgery to reset them. Others can be repaired without surgery. You may need to keep the ankle in one position and not let it move to promote healing. This is known as immobilization. To help with this immobilization, the ankle is put in a splint or cast. Casts are sturdier than splints. They are made of plaster or a synthetic material. Your healthcare provider should take your cast off. He or she will use special instruments. Do not remove your cast at home. Sometimes your bones will not be lined up properly. If so, your healthcare provider will reposition the bones before putting your ankle in a splint or cast. You may need to use crutches to get around while your ankle heals. This helps keep weight off the bones while they are healing. When the ankle is healed, the splint or cast will be removed. You will likely need physical therapy for a few weeks or longer to help regain strength in the injured ankle. Arthritis. Arthritis is a common condition. It happens when the cartilage and the synovium in joints are inflamed or destroyed. There are many types of arthritis that can affect the ankle. Osteoarthritis is more common in older people. It happens due to repetitive use of the joints. Repetitive use of the joints leads to wear and tear on the cartilage in the joint. Grinding and crackling sounds come from affected joints when they move. Post-traumatic arthritis is caused by joint trauma. For example, trauma may happen during a car accident or sports injury. Rheumatoid arthritis is inflammation of the synovium and possible destruction of surrounding joint. The cause of rheumatoid arthritis is not known. In rheumatoid arthritis, the immune system of the body attacks the synovium of the joint, destroying it. Rheumatoid arthritis runs in some families. There is no cure for most types of arthritis, but arthritis can be slowed and controlled. Medicines can decrease inflammation in the body. Physical therapy may be used to keep joints affected by arthritis in shape. Splints are commonly used to prevent, slow down, or make up for joint deformities. If other treatments are unsuccessful, surgery to fuse or replace joints may stop deformation and increase use of the joint.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Your ankle bone and the ends of your 2 lower leg bones make up the ankle joint. Your ligaments help steady and support it. Your muscles and tendons move it. Ankle injuries and disorders are common problems. Common ankle injuries and disorders include sprains, which are stretched or torn ligaments, fractures, which are broken bones, Arthritis, which happens when the cartilage and the synovium and joints are inflamed or destroyed. Symptoms of ankle injuries and disorders can vary widely and depend on the problem. The most common symptom is pain in the ankle or foot. Other common symptoms of ankle injuries and disorders are being unable to move your foot or toes, bruising, difficulty walking, swelling or weakness in the joint. Some ankle injuries and disorders may be treated at home. Others require medical treatment. Treatment depends on the problem. It may include medicines, surgery, or other treatments.
Thank you for using Explain.